So with the nerve plexuses, um, again, there's a network of anterior rami of spinal nerves. They're on both sides of the body, and coming out of these plexuses are nerves that have names that go to different parts of the body. So what we're going to see a lot of is nerves going to skeletal muscle. The main plexuses are cervical, brachial, lumbar, and sacral. So interesting point, the bulk of the thoracic spinal nerves do not form plexuses. They just go directly to structures. So, with the exception of T1, which actually is part of the brachial plexus. Okay, so starting with the cervical plexus, it's formed from the anterior rami of C1 through C4. Remember, this is both sides of the body. So you can see how what I'm talking about by a network of nerves. So all these anterior rami kind of get together and form this network. And the major nerve coming out of this plexus is called the phrenic. The phrenic nerve is the only one that we have to worry about coming out of this plexus, and it goes to the diaphragm. And the diaphragm is the big muscle that allows us to breathe. All right, just beneath that, C5 through T1 form what's called the brachial plexus. This coming out of this plexus are nerves that go to basically the upper limbs, muscles in the upper limbs, and you can see it's a really complex plexus. It's organized very neatly into roots, trunks, divisions, and cords. You really don't need to know that, but it's just elaborating on this picture right here. Just know that these anterior rami form the brachial plexus. Out of the brachial plexus, you get these 5 major nerves: axillary, musculocutaneous, median, radial, and ulnar. So we're going to talk about what muscles these nerves go to. So here's another picture where you can see these nerves are coming out of the brachial plexus. And here's the major nerves that we just mentioned. So you can see axillary is up here near the shoulder, musculocutaneous, upper arm, radial comes down the thumb side, lateral side, median basically right in the middle, going to the forearm, and then ulnar is the pinky side. So one by one, axillary nerve, big muscles that we've talked about that it innervates would be the deltoid, which is in the shoulder, and also the teres minor. So those are the big muscles innervated by the axillary nerve. Musculocutaneous basically flexors in the front of the arm, upper arm. So we have biceps brachii, brachialis, coracobrachialis. So all of those are flexors in the upper arm, and that's the musculocutaneous. So picture-wise, here's the axillary going out to the deltoid, teres minor, and then the musculocutaneous, all these flexors that we talked about in the upper arm. Median nerve goes to I always think of it as the anterior forearm muscles that flex the wrist, and also the pronators. So these muscles we've talked about: flexor carpi radialis, flexor digitorum superficialis, palmaris longus. Those are all in the anterior aspect of the forearm. Then you also have the pronator teres and the pronator quadratus. So pictures: front of the forearm, flexors and pronators. All right, then we have the radial nerve. The radial nerve primarily innervates extensors of the elbow and wrist. So the big ones include the triceps brachii, all these extensors in the forearm region: extensor carpi ulnaris, carpi radialis longus, extensor carpi radialis brevis, extensor digitorum. Then the odd muscle is the brachioradialis. It is innervated by the radial nerve, but it's not an extensor. It's just kind of an oddball. It's innervated by this nerve, but it's kind of the exception to the rule as far as what the types of muscles that the radial nerve innervates. So here's a picture showing all those muscles that we just talked about, extensors of the forearm and wrist, along with the brachioradialis. And lastly, the ulnar nerve. Flexors of the wrist specifically on the medial side, because remember, ulnar refers to basically the small finger or pinky side of the arm. The only muscle that we've really talked about that it innervates is flexor carpi ulnaris. And so another interesting fact about the ulnar nerve is that it runs right over the medial epicondyle of your elbow. And so if you ever hit the inside of your elbow on something and you get that weird sensation, you say you hit your funny bone, that's because you compress the ulnar nerve. All right, so picture-wise, here it is. All right, so moving on, that was like the most complex plexus that we're going to go through. So after that, it's a little bit easier. We have the lumbar plexus from L1 through L4. Two major nerves come off of it, femoral and obturator. And you can see the femoral here. It's going to go to muscles in the front of the thigh. Obturator, more so the inside of the thigh. And so you can imagine what muscles those are. Femoral. So we got the big hip flexors, the psoas major, iliacus, sartorius, and then all of your quadriceps. So the rectus femoris, vastus, lateralis, medialis, intermedius, or medialis. And then we have the obturator, which you remember goes to the medial side of the thigh. So all the adductors that we talked about, all the adductor brevis, longus, magnus, and also the gracilis. So picture-wise, here's the femoral nerve going to the quads and the big hip flexors, and the obturator, it goes right through the obturator foramen, and then it's going to go to all these adductors on the inside of the leg. Lastly, we have the sacral plexus, formed from L4 through S4. And the big nerve coming out of it is the sciatic. The sciatic is a huge nerve, and if you look closely at it right here, it's actually kind of like two nerves bound together. So there's two big branches. One's called the tibial, one's called the common fibular or common peroneal or perineal. And then the common fibular has branches also, which is we're not really going to focus on. So picture-wise, this is the back of the leg, sciatic, big nerve coming down, back of the leg. And then right behind the knee, it branches into the tibial, which stays in the back, and the common fibular, which wraps around the lateral aspect of the calf. All right, so as far as muscles, the tibial branch, basically big muscles on the back of the leg, most of the hamstrings, gastroc in the calf, soleus in the calf, popliteus, which is behind the knee. The common fibular, remember it wraps around the lateral aspect. So we talked about the tibialis anterior in the front and the fibularis longus on the lateral aspect of the lower leg. So picture-wise, here's the tibial branch. You can see the hamstrings, calf muscles, and then the common fibular branch wraps around. So you got the muscles out here on the outside, and then the tibialis anterior in the front. Okay, so a few other things just to finish up with. There are spinal cord reflexes. A reflex is just an involuntary response to some stimulus. So like an automatic response. So what you're looking at here is a reflex arc. So basically a reflex arc has 5 components. So there's a receptor, in this case looks like a nail or something is hitting the skin, and a reflex would be obviously to move that body part. So let's say there's a receptor that receives the stimulus. Then there's going to be a sensory neuron that takes that impulse to the spinal cord. That's part 2, sensory neuron. Part 3 would be the integration center, which is usually by some type of interneuron, but that's occurring in the central nervous system. Part 4 would be the activation of a motor neuron, which carries information back out. And then part 5 would be whatever is going to cause the response. In this case, it's an arm muscle that's going to move your hand. So let's say you put your hand on a hot stove and reflexively you take it off without even thinking about it. All those things happened that quick. So there was a receptor, there was a sensory neuron, there's an integration center, motor neuron, and then the muscle that actually moved the limb away. So that's a reflex arc. So you should know the components and then know the order of the components of the reflex arc. Other things about reflexes, the reflexes can be monosynaptic or polysynaptic, and that just is determined by how many synapses and the overall complexity of the reflex. But you can see in this case, there's no interneuron, so there's only one synapse. So this is called a monosynaptic reflex. Over here, there is an interneuron, so you actually get two synapses here and here. So this would be a polysynaptic. And then also with reflexes, we can have ipsilateral versus contralateral reflexes. So ipsilateral basically means same side. So what we talked about earlier was a ipsilateral reflex, where if your right hand touches something and your right arm muscle reflexively moves your hand away, the same side of the body, so that's ipsilateral. Some reflexes can occur on the opposite side of the body. So in this example you're looking at on the screen, this is called a crossed extensor reflex, where this person's stepping on a tack, and it reflexively is going to, he or she is going to pull the leg up on the same side, but at the same time the opposite leg is going to extend down to make sure that the person doesn't fall down. So that's a crossed extensor reflex. Some reflexes just affect the same side of the body. Some affect both same side and opposite side. That would be contralateral. All right, couple of final points. There are reflexes within skeletal muscle, which sometimes we talk about with skeletal muscle, but I think it fits better here since we're talking about reflexes. So in skeletal muscles, there's a receptor called the muscle spindle, and its response is to cause a reflex contraction in response to a rapid stretch. Example would be knee jerk reflex. You hit the front of the knee, reflexively you get an extension of the knee joint, and that's because you put a quick stretch on the quadriceps, and reflexively it's going to contract. So reflex contraction in response to a rapid stretch. And then lastly, Golgi tendon organ is a receptor in tendons, and it basically inhibits force production. So in other words, if your muscles were trying to generate too much force, the Golgi tendon organ would reflexively inhibit more force production to prevent you from injuring yourself.